interview Dr. Azim Jahangir Khan today at Cosmetic. Mr. Azim Khan is a diplomat at the American Board of Dermatology, diplomat of American Board of Internal Medicine, fellow of American Academy of Cosmetic Surgery, fellow of American Society for Dermatologic Surgery, fellow American Society's Liposuction Surgery, fellow American Society for Hair Restoration Surgery, Hair Laser Medicine and Surgery. So, and Cosmetic is the only place here in Lahore right now which is affiliated with the American Board of Dermatology and Cosmetic Surgery. So we'd like to welcome Dr. Azim Khan, and thank you so much for talking to us today, sir. To begin with, we'd just like to ask, what is cosmetic surgery and dermatology all about?
Well, the dermatology is the science in which we study and treat the skin diseases. And it's only not the skin diseases but also the appearance of skin. So anything which has to do with the skin, hair and nail, it could be the skin problems or enhancement of your routine beauty of the skin, hair or nails, which we deal with in dermatology. So dermatology is the science of the field of medicine in which we study the skin diseases, diseases of the nails, diseases of the hair, as well as we study how to enhance the beauty of the skin, hair and nail. On the other hand, the cosmetic surgery or cosmetic dermatologic surgery is the part in which we do the surgical procedure to enhance the beauty of the skin. It could be the beauty of any part of the body in which we reshape the body to make you look better. So that's what the cosmetic surgery is all about.
Dr. Azim, what are the common skin problems are prevalent these days that people are suffering from?
Well, in Pakistan, just like in any other country, we get to see a lot of acne or pimples. We get to see a lot of melasma or the discoloration of the skin which is on the face. We get to see a lot of eczemas or itching all over the body in the kids as well as in the adults. And one of the other prevalent problem which is very embarrassing, especially for the young females, is vitiligo. And that can occur in the kids also. It's the discoloration, the total loss of pigment from the skin. And you'll see a lot of people with that. And we have Alhamdulillah, we have a lot of new therapies for that. For example, we have a machine which is called the PUVA therapy. P is for solar, and the medicine we take, and then we put the patient into that machine. It has a certain kind of lighting in which when you expose the skin, you can actually treat the skin disease with a specific kind of light. It's a great advantage for most of the people who could not have been treated otherwise. Now, if we give this certain treatment to the patients who have psoriasis, now this disease with a lot of silvery scales, it's a very embarrassing disease. People can get from head to toe these thick red and silvery lesions, scales.
Alright, and while just coming down to your office, we saw all these places talking about hair removal, laser surgery. So do you think that everybody out there in the city has all of these machines being utilized into this? Or what is your take into the every center or every corner these days in Lahore? Well,
the unfortunate thing in Pakistan is that there is no calibration or there is no standardization of either the equipment or the qualification of the doctor. Look, you're dealing with a human life, with somebody's face. You should not be compromising on the quality. You can, by talking to the doctor, ask them where the machines are made, check out. Similarly, you can check out their degrees on the internet, and if somebody gets offended, they are probably not the right person or the place that you want yourself to be treated at.
Definitely. Also, many people talk shows are filled with these days this whole concept of liposuction and things attached to it. So basically, not our viewers, many of them won't know what liposuction is. If you could just briefly tell us what it is and how effective or non-effective it is, and to which type of people would you recommend it for?
Okay. Well, liposuction means lipo is basically fat, suction is to suck it out. If you look at the skin from side, so this is my skin from the side. If I cut it like this, the top layer is the skin, bottom is the muscle, and in between the muscle and the skin there is fat. Now when we suck it out, we have to know two things basically. One, the patient is not very obese. They are not grossly overweight. Liposuction is safe for those areas where the fat has not responded to your routine dieting. But liposuction is reserved for those people who are, for the most part, they are in good shape. They have certain areas of fat which are not responding to diet, and which are, so you want to shape it, you want to create curves and stuff like that. In the old days it was dangerous, but with the latest techniques, with the local anesthesia, with good techniques, it is very, very safe. I mean, you can have your procedure done in a couple of hours and go home.
To us today, Annette, I would just like to ask you a couple of questions about your cosmetic surgery. You went through a liposuction process here. Yes. How was it?
Well, it was scary. And I'm day 3. So I'm still a bit tender, but it went well.
So what were the reasons behind, just health-based reasons, or was it?
No. I wanted to just look better in my clothes, have a better figure, have a better posture. I'm 51 years old and always wanting to hide yourself, and so I had the surgery done.
So how was the care here, like as in if you had to rate it, as compared to anywhere else in the world? Did you feel that, it was up to the mark?
I'm from South Africa, where the Medicare is also very good. But I was treated extremely professionally and with kindness. And the care that the people give here is absolutely excellent.
I'm glad.
I've never seen a place where doctors actually care for you after an operation, and no, it was absolutely excellent.
So how's the weight yourself now and prior to the operation? As in, do you feel a big change?
Oh yes, I'm still swollen. It's only day 3, as I said, but already there's a big difference. So yes, I'm sure I'll be most satisfied.
Alright, and what about the cost effect? Was it, as expensive as outside, or was it a lot cheaper here?
It's much cheaper.
Much cheaper.
I was not able to afford it in my own country, let alone any other country, so yes, it was much more affordable, yeah.
What we were talking about was the facelift surgery. Facelift surgery is basically to tight the loose skin on the face to take away the wrinkles. And you can get a lot of benefit out of this little procedure, and people can actually, you can take away the double chin, you can take away the turkey neck, you can take away the extra skin wrinkles very effectively with the facelift. It's very, very satisfying procedure for the patient.
So compare that price to the price in Pakistan that you'd have to pay for this type of a procedure. Do you feel that it's economical, or it's restricted to a certain class, or?
Well, we get quite a few patients from the US as well as from England and Europe, because most of the Pakistanis who are living there, they come visit their families, and at the same time they want to have it done over here. If the doctor is having the same qualification as in the US, so why not would they want to get it done over here? Because it's much more economical. For example, if I was charging, for example, $10,000 for a liposuction in the US, here we are charging a couple of $1,000. It's like huge difference, many folds different. On the other hand, it's the same quality, because the same doctor working there, same doctor is working here, and if you maintain the quality, which we obviously have, Alhamdulillah, been successful, then obviously it's a lot of advantage for most of the patients to come here and get it done here, where it's much less expensive. It's much more economical.
Thank you so much, Dr. Azim, for talking to us. Any last thoughts for the people out there?
Well, I would say that, just like you buy your least important commodity, but you still shop around, you want to make sure you get the best deal. When it comes to your health, please pay attention. This is your life, this is your health. Any doctor you go to, any facility you go to, make sure that you are going to a qualified doctor. Make sure you are going to the cleanest sterilization facility. Make sure that you are taken care in the best possible way.
Thank you so much.